There we go. This is Noelle. Okay, we are good to go. Fantastic. Great. So thank you everyone for coming, all 34 of you so far. I'm Noelle. I'm here with the Disability Policy Consortium, and we're so happy to have this event to not only process together about these years we've had with COVID, but to figure out what we can do next to protect ourselves and our communities. So before we get started, I wanted to go over just some rules of engagement. Maybe you've heard these if you were on earlier, but some important things to keep in mind here. So first of all, please stay on mute if you're not speaking. And that will just make sure everyone can hear our speakers and we can all have our words translated accurately. And along those lines, we're going to have 4 sets of translation tonight. We're going to be streaming in English and Haitian Creole, and pausing for the interpreters, English, Haitian Creole, Spanish, and American Sign Language. So that's a good reminder to slow down. It's very hard for me. Please call me out if needed, but please make sure we can slow down and be heard. And if you need translation, feel free to message me in the chat and we'll connect you with the correct interpreter. Also, because we'll have people who are translating in ASL here, it's important to say your name before you speak so they can see, so they can hear who you are, even if we can't see you, and translate that. So every time I speak, I will say, "This is Noelle," and then I'll speak. You heard me do it a little earlier, and our speakers will do the same. I encourage you, if you have questions, comments, please do the same as well. And last but not least, please remember, we're all on the same side, and often these conversations can be emotional. We're talking about grief and it's a struggle, but we're here together and it's beautiful how we can support each other. So please know if you ever need to take a few minutes aside, totally fine, come back to the meeting, take whatever you need to take care of yourself. So for this first part of the meeting, we'll get into our speakers. I put their names in the chat, and they'll each try to speak for just a few minutes, pausing for translation. Please hold your questions until the end, and then we'll have a discussion. We'll also email any slides that are needed here. Thanks for reposting them. Yes, they're in the chat. And they'll say what they're going to speak on. So let's get started. First is Dr. Julia Koehler. She is an MD at Boston Children's. Thanks for coming, Julia. And feel free to jump in, Julia, and talk a little bit more about everything that you're working on, but specifically, oh, my link didn't show, specifically about school COVID protocols. Actually, sorry, this is Noelle. I have a more revised speaker schedule. I'd like to pass to Dr. Julia Raifman first. Okay. Julia's, it's very hard for me.
Hi, everyone. Thank you for having me. It's such a pleasure to be here. And thank you all for taking your time to support good policies, equitable policies in Massachusetts. So I actually have slides I'll share if that's okay. And that includes that study that just came up. And I guess I'll turn off my video so that you can see the interpretation. So I'll be talking about health and equity policies. I'm an assistant professor at the Boston University School of Public Health, and I study health policies. We see that the pandemic continues to be harmful in Massachusetts. This is a graph of hospital admissions in Massachusetts, and we could see that this spring, they actually got even higher than during the Delta spike.
Well, sorry, Dr. Raifman, sorry to
Yeah.
interrupt. Could everyone who is not speaking turn their screens off? That will make it easier to see translators with the slides. Thanks, everyone. Back to you, Dr. Raifman.
Thank you. So we see that hospitalizations can continue to rise even after we had such a high spike during the Omicron BA.1 surge. And I think that COVID transmission is likely to rise again as we see an influx of college and university students coming to crowded indoor settings, and elementary and high school age students going back to school at the same time. Health and equity policies can reduce the harms of COVID to health and in terms of economic hardship and disruption of school and work. Vaccine and booster delivery for all ages at school events is key. Every school should be hosting a back to school vaccination event. And it's great to provide activities and food at those events to draw a lot of people. We should be prepared for surges and not reacting to them after cases and hospitalizations are already high. It's important to implement policies that reduce the growth of surges from the beginning. So data-driven mask mandates that turn on just when surges are starting can make a big difference and can make sure that students don't need to wear masks all the time, but that they wear them when it's most important. We can fund routine testing, especially in surges, and free tests and high quality masks. This is not something that the state or city has planned right now, and it's very important for reducing onward COVID transmission. We can improve ventilation and filtration and make sure that schools and workplaces meet standards for ventilation and filtration. These policies support continuing education, continuing to support parents and teachers going to work, and they support social, emotional, and physical health, allowing people to continue to gather in person, but more safely when there are surges. Massachusetts needs to vaccinate more children. COVID was a leading cause of death in 2021 for children. It was especially a high cause of death for children under the age of 1 who can now be vaccinated but are not vaccinated. Just 11% of children 0 to 4 years old are vaccinated at this point. Vaccines reduce the risk of severe disease for children and their family members and caregivers. And Massachusetts needs to do a lot of work to increase child vaccination rates and adult booster rates. We have a new study that shows that good leadership on layered mitigation in surges makes a big difference. In February, DESE dropped the Massachusetts mask mandate, but Boston and Chelsea maintained their mask mandates. And this is a graph depicting what happened with COVID cases per population in the schools after the mask mandates were changed. So down here at the bottom in the never lifted category are Boston and Chelsea. And all these other places at the top lifted their mask mandates back here at the start of a surge. So you can see what a big difference it made for Boston and Chelsea to maintain those mask mandates. And these policies improve population health. They reduce disruptions of education and of family members' work. And they support continuing education and continued teacher retention, as we have a teacher shortage that is emerging. Here we can see that impact in detail. So dropping mask mandates over 15 weeks was associated with 12,000 more cases, 17,500 more student absences, and 6,500 more staff absences. These absences can mean missed work for teachers and for caregivers, and that can result in economic hardship. So these layered mitigation policies make a big difference. Thank you. And please call your policymakers to tell them these policies are important to you. They hear a lot more from people who are opposed to mitigation policies. So please call and ask for mask mandates, ask for them to supply tests and continue routine testing in the coming year. Ask for them to take COVID seriously. Thank you.
This is Noelle. Thank you so very much, Julie. I'm sure so many people will have questions. I'm asking you to hold until the end, but we'll be sure to share those out if you'd be comfortable. We're going to move right into our next speaker, Nicole. Thank you for having us, Nicole. Please say your name before speaking and take it away.
This is Nicole. I hope everyone can hear me. I let people know that I was at a Patriots game, so I have a little COVID anxiety around that. I just quickly wanted to discuss two things that I think have really complicated living with COVID. The first thing I want to address is the lack of affordable housing. Personally, I live in a co-op community, which is a shared housing situation with 8 people. We share responsibilities, but it also brings along stress. There's less personal space, and there's sort of a blurred line between what is quarantining and what is cruel isolation. And what I've seen with other people who have no choice but to live with many people is that the stress is high, and we all go back and forth on how to deal with that and how to maintain closeness while staying healthy. I think there needs to be a big emphasis on the housing crisis, especially during 2020 when a lot of landlords were not being kind. But I think even now, people are recovering, trying to find work, needing to be close to the city to get to those jobs, and only having so many options for housing. And this, of course, leads to more exposure levels, higher rates of staying out of work. So people that already can't afford to live in their own space now are missing days of work, pay, and even being able to get support from families. I think living in a group situation makes you commit yourself to group think in order to keep COVID cases contained. And people may say the solution is to live with less people, but because of the rising red, that really isn't a reasonable response. So it really has to do with structural change. And what I found myself living in close quarters and different people having different immune systems is compassion fatigue. Feeling burnt out due to the ups and downs, emotionally, new diseases coming out, the state and the federal government telling us different conflicting ways to treat COVID. And I think the biggest issue with all of this is not feeling in control. So I would love to come away from this meeting feeling like we as a community have a game plan and we're able to respect the challenges of people from different socioeconomic statuses. I wanted to send my support. I know it's been a hard time, but thank you for having me speak. I continue to organize in the community and look forward to hearing the other panelists. Thank you.
This is Noelle. Thank you so much, Nicole. I understand if you need to leave, but everyone please reach out to Nicole. It will be so great if you can stay to hear your feedback as well. Moving right along. First, I just want to check in with the translators. How is the speed of everything going? We're trying to speak a little slower. It's awesome. Great. Perfect. So I'd like to introduce our next speaker, who I started to introduce, Dr. Julia Koehler. Now's your real moment, Julia.
One moment, we're going to switch interpreters. Let's just make sure that the spotlight is on Katie Eller now. It's not on the right person still. One moment. Okay, here we go. Thank you.
Hi, thank you. Thank you so much for having me, Nicole. My name is Julia Koehler. I'm a pediatric infectious disease specialist at Children's Hospital, and I work with many Latino organizations and Brazilian regarding the COVID, how to protect ourselves, how to cope with the rapid new developments situation. And one of those rapid new developments is the availability of a medication that was shown in a clinical study to decrease the need to be hospitalized and the risk of death in people who start taking this medication within 5 days of feeling their symptoms. That medication is called Paxlovid. It is very useful. It has some serious issues associated with it. And those issues highlight the ongoing profound structural racism that has characterized, that has pervaded this pandemic since the beginning. Since in 2020, it was found that for the first 9 months of the pandemic, the death rate, the age-adjusted death rate among Latino and Black residents of the state of Massachusetts was over 3 times that of white residents. And this structural racism, where you think, okay, 2 years later, we know what to do, we've seen it, we're going to do better, persists with access to this potentially life-saving medication. And why is that? So quickly, if you're above 50, if you have a disability, if you have diabetes, if you're obese, if you have some pre-existing serious condition, you may benefit from taking this medication, Paxlovid, within 5 days of your symptoms. But someone needs to check whether a clinician, a doctor, and now since July, a pharmacist needs to check whether you're taking any medications that might interfere with the Paxlovid, or the Paxlovid interferes with your other medications. So it is about access to medical care, and it is also about whether those medical providers even think about giving you Paxlovid. And in the immigrant communities in Chelsea, where people are still standing in lines in the heat to get food every week, and in East Boston, where the lines in front of the soup kitchen are longer than they have been in a long time, people are not getting informed, people are not getting prescribed Paxlovid. And I'm just going to show you one slide here that illustrates this in my opinion, shocking way. And this comes from Massachusetts General Brigham System, where actually some wonderful people made the effort to look of all the people 50 and above who tested positive for COVID and who therefore might have been just inherently eligible to get Paxlovid. How many people of different races and backgrounds actually got that prescription? And of note, you can get that prescription if you are 12 years and above, and you must be 40 kilograms, which is about 85 pounds and above. But if you have a risk factor and you are in that category and age above 50 already is a risk factor, then your doctor should really strongly consider prescribing you Paxlovid. And I'm just going to show you because it first came out in December of last year, 2021. Okay, here it's starting to take off these prescriptions among Mass General Brigham providers. And these are already, in other words, people who have had a chance to see a doctor, which is already much more than so many people in communities who have been left behind from the beginning of the pandemic are able to do. So many people don't have a primary care doctor. So many people cannot get a hold of their primary care doctor. So many people don't even have insurance to start with. So looking at this, so here are the increasing numbers of total Paxlovid prescriptions. Here it's starting to take off in February. Here we're in May when a wonderful person, like I said, did this study. So who is lagging most behind in Paxlovid prescriptions? It is Black patients. Who is getting the most prescriptions? White and Asian patients. And who is not far above the neglected Black patients? It is Hispanic or Latino patients. And that same dynamic is just shown in a different way here. Black patients, the tan bar, Hispanic or Latino patients, the blue bar, white patients, the green bar, and Asian patients, the purple bar. So what we need is to inform communities, to raise awareness also among doctors, but most importantly, our communities, every community needs to know that if you feel like you might have COVID, get a test, because if you test positive, you have 5 days since the beginning of your symptoms to get this prescription. If you're beyond those 5 days, if you have not had access to a test, if you don't know where to get a test, or if you have not been able to reach a prescriber, a doctor, or now potentially a pharmacist, you cannot get this medication. And so people need to know, I need to pay attention to the symptoms, I need to get a test, and I need to test myself. And if I'm in that 5-day window, then I can get a prescription. Also, regarding structural racism, I'm just going to highlight one more thing. The state created a website where you can access a free telehealth consultation for Paxlovid. However, you need to have an email address. You need to provide an ID. You need to be able to take phone calls that are returned to you. So those 3 things alone are serious barriers to the communities that I'm talking about. And some of us have made the state aware of that, like 2 months ago, 2.5 months ago, no reaction. Not to mention the fact that there is, from the side of the state, zero outreach to inform people about this option of Paxlovid. I don't want to say zero, I'm going to say zero that I have seen or heard about or know about. So I'm sorry, I have to correct myself there. So it is up to the community-based organizations to inform their communities about this option. And, you know, again, we're at the same point as at the very beginning. And I thank you for all your work that you're doing to alleviate these injustices. Thank you so much.
This is Noelle. Thank you so much, Julia. That was amazing. I'd like to pass to our next speaker, Gabby Cartagena, and she is going to talk about why rent control and participatory budgeting are matters of public health. And just as a reminder, just to be respectful of our translator's time, we're going to try and stick to 3 minutes if possible. Thanks, Gabby.
Awesome, thank you. Hi, everyone. I'm just gonna put a little timer for myself. Clock. Awesome. Hey, everyone. Good evening. My name is Gabriela. I'm one of the communications co-directors at City Life Vida Urbana. And City Life Vida Urbana, for those who don't know, is a housing justice nonprofit in the Boston area. City Life dedicates itself to help empowering and teaching basic tenant rights and homeowner rights to tenants and homeowners, so they could best equip themselves to fight against an eviction or foreclosure, or renegotiate against an exaggerated rent increases, or just for better conditions. And through the use of public pressure and legal defenses, which is a fighting strategy that at City Life we like to refer to and call the sword and the shield at City Life, right? The use of public pressure and legal defenses. And what we're seeing ever since the pandemic hit, before the pandemic, there's always been a housing crisis. And once the pandemic hit, the housing crisis has worsened, right? Right now, today, like we're at some of the highest rates of inflation from the past 4 years. And housing costs like rent and even just first-time home ownership is just increasing and like getting out the grasp of like affordability for many people. Boston right now, many people, medium income isn't enough to like keep up with these like increasing housing costs. Like, for example, like a medium 1-bedroom in Boston is now 27%. And throughout the city of Boston, like during and before and even after like the different eviction moratoriums that have existed in Massachusetts and result of the pandemic, hasn't been enough for the protections that we need right now. Right now, there has been over 36 eviction filings for evictions throughout the state of Massachusetts. And one thing that we're pushing for to be able to like mitigate this crisis that is deeply affecting like communities of color the most, people of color, Black, Latina, Indigenous, Asian are twice more likely to be evicted throughout the state of Massachusetts, and 70% more likely to be evicted in the city of Boston. And one thing that we're fighting for at City Life and have been fighting for throughout this housing justice movement in the state of Mass is pushing for rent control and participatory budgeting. So right now in the city of Boston, we're seeing the movement for rent control growing. And, one thing I want to share with you all before like getting off this call is like the importance and voice that you all currently have in submitting a testimony as to how rent control can work in the city of Boston. And there is a statewide fight that is continuing again, restarting again, now that this legislative session has recently ended and will restart in the state of Massachusetts. With Governor Baker getting out, like we see the possibility of rent control like higher than ever. So this is a movement for us to just like reignite and join, and like an easy step is like submitting a testimony and just get connected to City Life to know what other steps like you can do to support the fight for rent control, which would promote like healthier and stronger communities across the Commonwealth. Thank you.
This is Noelle. Thank you so much, Gabby. Really appreciate that. I'm sure people are going to have questions about the testimony process more. So we'll just finish our next two speakers, and then I think we'll start our questions going right to you. I'd like to introduce our next speaker, Ed Childs. And Ed is going to talk about the workers' struggle, a walkout that happened today over not having COVID workplace protections, no PPE. Oh, sorry, I think someone said something. But just in general, the labor movement from his union organizing and why we need COVID protections maybe more than ever during this pandemic. Passing to you, Ed.
Hi, I'm Ed Childs. I'm with Local 26 Unite Here, here in Boston, the hotel restaurant workers and university workers. The picture behind me is a picture that shows how labor is behind and been struggling around this, and a lot of the things that we have gotten is because of some of these labor struggles. There's been over 24 major strikes in the last couple of years. These are strikes well over 1,000 workers each. So the participation has been at least probably close to 300,000 workers have been on strike. A lot of their demands have been wrapped around the COVID protection. Here in Boston, particularly, what you see behind me is a walkout. Actually, it's a walk-in by workers at Harvard University who were demanding PPE. Harvard University said that they would not give PPE, they would not finance it, and they wouldn't give us tests or anything. So workers, 700 of us walked off the job, actually walked in and demanded PPE, and we wouldn't work until we got it. And we got it. We also had some walkouts because they refused to tell us that there was an infection in the area. If somebody got infected and they either a student or a worker, they wouldn't tell us. So that that's when we demanded more testing. The same thing in the hotels here in Boston. We have 10,000 hotel workers here. We demanded safe working conditions, PPE and testing. But the other thing that we're all demanding is money, unemployment pay. And a big thing is when you get a shutdown, you get your job back. The problem is, especially in the non-union workers, we've the hotels that shut down that were non-union, they were all fired. And we've been helping them to try to get their jobs back. Fired workers, you just heard about housing particularly, but other things, really a detriment, not only for those individuals, devastation, but also devastation to the cities. So that's why the struggle has been about compensation when you get infected also. So when you get infected and you're out 5 to 20 days, a lot of people aren't compensated. They don't have enough sick pay. So in our struggles, we demanded full compensation by the hotels or the universities. To do that, we need a lot of demonstrations and Zoom rallies, both to the employer and to politicians. Other struggles that were happening in Boston, particularly the school bus drivers, demanded safety. They had a huge struggle. They would not drive until the city of Boston made their conditions safe, both for the drivers and for the children. And they also be compensated when they get sick. Teachers also had huge struggles, not only here in Boston, but throughout the country, demanding safety in the classrooms. They had many demonstrations here in Boston. Dedham had this famous demonstration, but all through the country, New York, Chicago particularly. And so these have been labor struggles. The Teamsters have led them. Nurses have led them all through the country. You've seen the St. Elizabeth strike here. SAU, the custodians to social workers have been in this struggle, demanding these things. And what you see is usually from these struggles, even if you don't know they came from these struggles, a lot of the stuff that happened. Telephone workers. I just met with the Starbucks workers who are on strike now in Commonwealth Ave. And they were telling me that throughout the country, the reason the Starbucks workers started to organize was about COVID safety on the job. So it has spurred on the labor movement, and the labor movement has spurred on the demands about COVID safety, compensation, and other things. And we in labor want to make sure that everybody knows to implement these plans, you're going to have to struggle in your unions. If you ain't got a union, struggle to get one. Also, these tenant groups, vital at this period of time, as they and community groups. Struggle is the only way we're going to get anything going on here. So that's what I wanted to deliver, and that's what labor and unions wanted to deliver to this struggle. Thank you.
Thank you so much, Ed. This is Noelle. We have our last speaker, Felix Jordan, who's going to speak about environmental justice as protection of public health and ensuring rights for Boston's residents with disabilities. And I will put Felix's slides in the chat. And yeah, Felix, yeah, I'll put the slides in the chat and they'll email them to you when ready. Whenever you're ready, Felix.
Can we pause to switch interpreters? One moment, please.
Absolutely. Sorry, I muted myself.
Please put the spotlight on Joe Toledo and off of Katie Eller. Thank you.
Fantastic. Just waiting for that. Awesome. Perfect.
All right, hi. I'm Felix. I'm a community organizer at the Boston Center for Independent Living. And if anyone benefits from visual descriptions, I'm a Black person wearing a funky yellow and blue top, and there are like mushrooms behind me on my wall. So I'm going to talk a little bit about environmental justice, public health, and disability. So the EPA defines environmental justice as the fair treatment and meaningful involvement of people regardless of race, color, national origin, or income with respect to development, implementation, or enforcement of environmental laws, regulations, and policy. And I personally like to look at a really broad definition of the environment, so including not just trees and what we consider nature, but also the built environment, the buildings that we live and work in every day. I really came to my job at the Boston Center of Independent Living as an organizer with the belief that accessibility issues are very much so environmental justice issues. People with disabilities and chronic health issues are, especially people of color who are living with disabilities, are way more likely to be affected by pollution, climate change, and other disasters that will be exacerbated and or directly caused by climate change. A really frightening statistic is that from the Senate Special Committee on Aging is that people with disabilities and elderly people are 2 to 4 times more likely to die or be seriously injured in natural disasters. I think it's also really important to acknowledge that in environmental justice, there's a really big concept of undue burden. And in thinking about the ways that people with disabilities are disproportionately harmed by certain things and are also barred from experiencing their environments in certain ways, whether it be through physical barriers, financial barriers, et cetera. And the pandemic has really showed us how quickly people with disabilities can be seen as disposable. I don't know if you guys remember at the beginning of the pandemic, there was a lot of rhetoric about, oh, it's only immunocompromised people, it's only people with disabilities, we don't really have to worry about it. And I think we're sort of seeing that as a resurgence as people are really wanting to quote unquote get back to normal. And so I really think that the optimal sort of COVID response and relief that we should see, we really want to focus on relieving what's going on with COVID and responding to it appropriately, because it's an issue of equity. The pandemic isn't over, and a lot of people don't get to pretend that it is. I'm going to pause for interpretation. Yeah. Yeah, a lot of people don't get to pretend that it is. I know people who have still been quarantining for years. And the more we continue to let COVID run its course, the longer we decide that certain people don't get to access society in the same way because it's their problem. Minimizing the spread of COVID is extremely important, with vaccinating as many people as possible, with the use of PPE, with ensuring that there are city and statewide programs to get people PPE and community groups that are able to use that funding to do so, consistent access to testing. These are not only common sense, these are life-saving, and these are telling people that by implementing these measures, we don't see people as disposable, that we want to protect as many people as possible. Obviously, we can't save anyone, or can't save everyone, but we have to at least try and demand policy that tries. And I think rental assistance programs, PPE funding, that sort of affirm a right to live a safe and healthy life, and affirm sort of the belief that people need livable conditions. We realize that if people need to shelter in place, they need shelter, and certain programs can help that. Yeah, that's really my spiel. Thank you.
Thank you so much. This is Noelle. Thank you so much, Felix. It's amazing. All right, so time is winding up. Give me just a moment, please. I'm going to change one of my mute settings. I'll be right back. But we're going to move into our discussion period now. Brendan, could you remind us of our discussion norms?
Hi, everyone. This is Brendan speaking. I just wanted to remind everybody that when you're speaking, please try and keep it brief and direct. Speak slow enough for the interpreters. We want to be respectful to everyone, and we want to just encourage everybody to pretend, well, not pretend. We want everybody to act like they're on camera. Thank you.
Thanks, Brendan. Yes, this is Noelle. Just a reminder, this is being broadcast and put online, so please just be conscious. It's like we're all in our homes together. It can feel sometimes, like we're at home and we're alone, but please just be fully clothed before the camera. We have some amazing families with kids here online as well. All right, great. That bit of housekeeping is over. And I'd like to jump into questions. So first, I've noticed a lot of people have messaged me about Gabby's presentation. Does anyone want to ask questions? Feel free to unmute, and you can ask any questions for any speakers as well.
Does Lydia have a hand up?
This is Noelle, good catch. Let me unmute. She can't unmute. Let's see if this works, Lydia. You're good, you're unmuted.
Hi, yes. I have a question. It's kind of like a two-part question. First for, I believe it was the professor from Boston University, and also internal medicine. So my first question is, last week on the news, they stated that one of the students, I guess, came back with the monkeypox. And they said that they're still waiting to hear from someone from Boston University to explain what's really going on in the situation at hand. And I I was wondering if you may know anything, Professor Raifman, based on what they were saying last week on the news, and if so, what are they doing to resolve the situation? My daughter goes to BU, and when she heard, this is going to be her sophomore year there, so when she heard, it's like, Mommy, I don't want to go back, you know. So now I'm kind of stuck at what to do, because I haven't heard anything from the school, and I haven't heard anything else on the news as well about what's going on. And that's the first question I have for Dr. Raifman, or Professor, sorry. Oh, I can say my second question. I'm sorry. So my second question would be for internal medicine. Are there procedures put in place already to prevent the spread of the monkeypox? I mean, I'm kind of already used to the whole corona situation. I've adjusted to that. But what about the monkeypox? Are they doing, if anything, to try to keep it controlled, should I say?
This is Noelle. Thank you so much, Lydia. I'll pass this to either Julia or both.
This is Julia Koehler. I'm a pediatrician, not an internal medicine doctor, but I have been thinking about monkeypox. And unfortunately, just like COVID, our public health authorities were unbelievably slow to respond. So the question for each of us, of course, is, how does this affect my loved ones and me? And thankfully, monkeypox is not spread through the air like COVID. So, you know, we don't have to worry about being in an enclosed space with someone and getting monkeypox. That is not how it's transmitted. It is transmitted most clearly and most obviously through skin-to-skin contact, especially if somebody has those skin bumps or lesions. So that is why people who have lots of skin-to-skin contact with many other people, and that could be, you know, let's say, I'm going to just say wrestling or athletics like that, are going to be, you know, more at risk. It is also spread in families through skin-to-skin contact. And that's why children have gotten it. It is not, in a strict sense, a sexually transmitted disease, because like condoms don't protect against it, because it's simple skin. It is not, you know, genital area skin that will transmit, you know, where the contact, the touching will transmit the infection. And in my personal opinion, the protections we need are widespread testing, vaccine for everybody. So far, much of the spread has been in the gay community, and people in the gay community who know that they are at risk should have access to the vaccine, no questions asked. And also, what we don't know very well is, for example, a hotel worker who is, you know, taking off sheets from a bed where someone with monkeypox or even incubating monkeypox has slept. What is their risk? We don't really know that. So in my personal opinion, hospital workers and hotel workers who deal with with cloth that potentially has virus on it should be specifically protected, and there needs to be guidelines for PPE. Simply being in a cafeteria, let's say of Boston University, and somebody else, even at your own table, has monkeypox, is very, very unlikely to get you infected. So although we need to think about it and focus on it, at the same time, I think we don't have to freak out. I think we keep our eye on the ball of airborne transmission of COVID by aerosols, which is like cigarette smoke spreading through the air. That's why we need ventilation. That's why we need access to high quality masks, which are N95s or KF94s for everybody, adults and children. That's why we need the ability for paid sick leave, paid family sick leave, because we have much less control over what we breathe in than over whom we touch, whom we hug, whom our skin, our whole body touches. So those are the differences between those two infections and how we are put at risk just by going to work or doing our daily activities of daily life, going to school, etc., where we are at high risk of COVID with lacking protections, whereas with monkeypox, we are not at high risk. Thank you.
Thank you so, this is Noelle. Thank you so much, Dr. Julia. Just want to check, does the other Dr. Julia want to comment?
We're going to switch interpreters again. If we could pause, please.
Perfect.
Thanks so much. Do you want my my comment on the on monkeypox?
This is Noelle. Lydia, whatever you prefer. Yeah.
Yes, I just wanted to know about the announcement that was made on the news last week. I believe it was Friday or Thursday, about one of the students coming back with the monkeypox. I wanted to know if you heard about that, and if so, are they trying to implement something to, even though I know it's not airborne and it's by touch, you know, kids at the universities are usually grouped up. And my daughter, she heard about it when I was watching the news, and it's gonna be her sophomore year there this coming year. And now she's kind of worried, you know, like, mommy, I don't know, I gotta move into the dorms and I don't know what I'm gonna do. So I was just wondering if has Boston University made a statement based on that?
Thank you for that question. I hadn't heard about that case. You know, I think it is important to communicate, you know, especially like starting from the top, that the CDC communicate that monkeypox is a risk on campuses, and safe practices for reducing risk. Same with COVID. COVID is also a risk on campuses, and you know, and mitigation policies are especially important in crowded indoor settings like universities. You know, I think we've seen that the financial interests are causing some downplaying of these risks. And so I think, again, it's helpful to contact your local leaders, to your local policymakers, the mayor, the governor, to let them know what policies it would be helpful to, what policies you would like to see, and that it's important to you to see public health policies on college and university campuses, and also to contact institutional leaders like university leadership to let them know that you would really like to see public health a priority and mitigation policies and communication. I think that it's important for leaders to hear from people who are part of their populations. I think they hear a lot from people who are against mitigation, and so it's helpful to support that.
This is Noelle. Thank you so much. Speaking of which, of talking to our public officials, contacting them, I wanted to loop back around to Gabby because we had a lot of questions about that. People asking how to submit testimony, what they should say, all of that, and how to communicate that it is a matter of our public health, how having affordable, accessible housing means we actually we have somewhere to be safe in. And, if we get sick, to even quarantine if needed. So Gabby, does anyone want to ask any of those questions? They were messaged to me in private, so I won't read them. But if you have a question, feel free to ask. This is Noelle. Perfect. So I'll just take a moment here and I want to just give our announcement for our breakout rooms. So technically our event is over, but we have an extra hour if anyone needs help with raft applications, ERAP, signing up for SNAP benefits, Mass Health. We have people here who can help us in breakout rooms. We have some translation ability as well. And we'll put you into those breakout rooms if needed. So does anyone, or if you don't want to say, feel free to message me in the chat and we'll put you in those breakout rooms. And feel free to go as needed, but I do want to get through some of our questions since everyone was so good about holding them to the end. So if you need breakout rooms, message me, tell me what you need, what service you need signing up for. Awesome. I will start building those rooms. And I have a question that I can read out loud. Before I do that, I'll go over the services again. They are SNAP benefits, ERAP or RAPT, depending on what you need. Mass Health benefits, getting signed up for Mass Health, that is. And I believe that's it, but some people didn't show up. So perfect. Okay, I will start putting those rooms together. We're having some signups in. Awesome. So in the meantime, we had a question. I'll just read it out really quickly, and then I will put people in rooms. Thank you so much, Gabby, for your powerful words. So the question is, hi, I'm so glad to hear Ed's point. I work in a local food restaurant. They said the name of the restaurant. I'm blocking it out. How do I tell my manager that we need masks provided and more protections against COVID and monkeypox? I don't have a union I know of. Ed, would you like to take that?
Say that again.
So this is Noelle. The person wants to know, they don't have a union, so how can they get their management, they work in a restaurant, to start providing masks for employees and other health protections for COVID? Maybe even, they didn't say this, but talking about how to get time off if you test positive, that sort of thing. How can you fight for your rights if you don't have a union helping you while you're working in Boston restaurants?
A little difficulty, but you have to, you're gonna have to talk to your other workers and maybe get a petition or something. You should also contact Local 26 if you're in a restaurant. We might be able to help you. So it's Unite Here Local 26. They have been helping a lot of non-union workers both get their jobs back or help them with PPE. But the other thing would just be on your job, get the workers together, go in as a delegation to the management. It's a lot more powerful than by yourself, and maybe even get a petition of a lot of the workers. You can also call the state. If they're not giving you what you think is it's an unsafe conditions, you could call the state. So that's it.
Thank you so much, Ed. This is Noelle. That's great. I know that Dr. Julia Koehler has also talked about working with, I think, the Brazilian Workers Union. Is that right? Would you be able, Julia, to share some of the lessons you've learned there in getting workers able to have those protections for free?
Sorry, I'm eating, sorry. This is Julia Koehler. I would say the organizations that I have most experience with are organized at the community level and not at the workplace level. And I know that it is a challenge at the workplace level because you are so exposed to retaliation. And that's why what Ed is saying makes so much sense, that, you know, you do not want to be the one nail that sticks out that gets hammered down. So I think it is all about connecting with people in the same situation and raising the issues together. Now, there is one place where I know, so what I would say is start with your coworkers, and then number two, there are I would say three other places where I know you can go. One is MassCOSH, the Massachusetts Coalition for Occupational Safety and Health. They are brilliant. They are so knowledgeable. And they, you can find their info online, or I'll find it and put it in the chat, contact info, and they will be able to advise you on what kind of protections are needed in your workplace if you need that advice, and also how to insist on that. So number one is MassCOSH. Number two, there are workers' centers that defend workers' rights around, you know, Massachusetts, the Boston area especially, but everywhere else. So find a local workers' center if because many of the workers that organize there also do not have a union to represent them. That's our big, you know, deficit in this country. So, for example, the Brazilian Workers Center is a workers center, and it does represent workers in small workplaces or wherever where workers are not unionized. And then thirdly, the Massachusetts Attorney General actually has a phone hotline where you can call in concerns, including workplace concerns. And although, you know, all these lines get more calls than are possible, I would say it's worth a try. And one thing is for sure, you will not face retaliation because the current Attorney General has really tried to support workers when these kinds of issues came up. So that's another place to start. So those are my three places where, in addition to your own coworkers, you may find people who have your back and who can give you advice. And how can you find the workers center nearest to you? I have to think about that, but you can start with MassCOSH and the Attorney General's office, and MassCOSH can also connect you to a workers center. And I will put the MassCOSH information in the chat. They can also connect you with the OSHA actually office in Massachusetts, which is a federal agency who also I think have their heart in the right place. So thanks, I'll stop here.
This is Noelle. Thank you so much. That's so helpful. There's also a question. This person went into a breakout room, so I will read the question. Would it help if restaurant patrons support staff at the restaurants they go to, say by asking management why their staff isn't masked, or would that cause trouble for staff?
Can
Whoever-
we pause to switch interpreters, please?
Sure.
Can you put the spotlight on Joe Toledo?
This is Noel. Yep. Joe should be spotlighted. And who would like to answer that question?
I could.
Go for it. This is Ed.
Oh, definitely. One thing that workers need is especially in our industry, is help from the customers. They always try to undo what we say because they say, well, customers don't support it. Well, when you take initiatives like that, not only does it undo the owner's false wording, but it also encourages the workers to actually do something. So yes, definitely. If you're in a restaurant, if you're in a hotel, if you're any workplace, you should demand PPE be done by the workers. And no, it will not injure the workers whatsoever. Thank you.
This is Noel. Thank you so much, Ed. I wanted to ask also, what can we do if we know people who maybe aren't able to get the monkeypox vaccine yet because they don't meet the strict criteria? Do we know when it will be available to more people? This is Noel. I'm thinking either Dr. Julia would be great for this question.
Yeah, okay, this is Julia Koehler again. So the monkeypox vaccine availability is a long and not a good saga, but one solution to the dire lack of monkeypox vaccine that we needlessly had in this country is to give the vaccine in a slightly different way. And that way you can give a smaller dose. And that way there will be many more doses. That slightly different way is to inject it with a needle into the most superficial skin layers rather than a little more deep. So you basically just put it slightly in a different place within the skin, and you can use a lower dose. It's going to be more effective that way. And so the same amount of vaccine now stretches 5-fold more. So I am hoping that those measures are going to be implemented very soon, so that all the people who know that they are at risk, and you know, there are many people who already know they're at risk, but they haven't been able to get the vaccine, can get it. And then number two, so that there can be outreach with an actual message of, you may be at risk, please get the vaccine, and it's right here. Because that messaging right now would be useless because there has not been enough vaccine. Another point to note is that there's also a medication, but accessing that is extremely difficult. So it is really the federal authorities that, and also then at the state level authorities, but this has been at the federal level that need to turn this around. And I couldn't agree more with Julia Raifman, who says we need to contact our elected representatives because they always hear from those people who are accustomed that their voices are going to be heard. And they so rarely hear from those people at the highest risk. And we need to change that.
This is Noelle. Thank you so much, Julia. We also have a question for all of our panelists. We said on social media that we're calling on the city of Boston to bring back a mask mandate on trains and to reinstate PPE funding for community organizations so they can have masks, hand sanitizer, those types of things, and be able to pass them out to people. So we know why this is important, but maybe could you say, maybe even from a medical perspective, a little more about community transmission? Question for any of our panelists. If Dr. Raifman is here, that would be a great person to take this question. I know Dr. Julia is eating. Well, that's okay. We also have a question that's a really good one for Felix. Are you still on, Felix? Perfect, great. It came in through the chat. Let me just scroll and read it out. Awesome, I can't totally find it, but the question was about participatory budgeting and rent control, and asking how would rent control help residents with disabilities if you don't qualify to receive SSI benefits or aren't federally recognized to have a disability? Will rent control still be helpful for you?
Yeah, I can speak to that. Do I need to be like, would it be helpful if I was spotlighted? I can also not be.
Oh, sure, one moment.
Yeah, I definitely think it would. My thing is, I believe rent control would help literally everybody. I think that on average, people with disabilities spend about 27% more on their income to have the same quality of life as people with no physical or mental, psychological, neurodivergent disabilities. That's on medication, equipment, XYZ. And I think rent control means that you know that you are not going to have your living situation sort of thrust upon you. And I think the knowledge of not having one less thing to worry about is something that would help everyone, but especially people with disabilities that have sort of fewer resources occasionally. And I think especially if you are someone that doesn't have necessarily a recognized or documented disability, because it is that much harder to get accommodations. And under rent control, it means you don't necessarily have to be like, I am a person with a disability, I need this thing. It's just sort of codified into law that everyone gets it. I am of the mind that accessibility is for everyone, even if it's only for quote unquote for certain people. Yeah.
This is Noelle, absolutely, 100% agree. Does anyone else, any of our other panelists want to speak to that? I know we also have Lady on the call, who is a rent control advocate. Not to put you on the spot, Lady, but if there's anything you'd like to say, that would be great. This is Noelle again, going once, going twice. Awesome, perfect. So also I want to go into a little bit more kind of hearing from all of you. Anyone can answer these questions here. What would help you right now most in your life? What are you looking for now? Do you feel like we need access to more food or better food, fresh vegetables? Are we looking for lower rent? What right now has this pandemic shown you that your community really needs? This is Noelle. I'm gonna, I have to call on someone. So I'm actually going to call on Leslie, who does quite a bit of community work. Maybe Leslie, you can introduce yourself. Oh, I don't know where Leslie just went.
This is Leslie.
Oh, perfect. Great. This is Leslie. I will stop you. Maybe you could speak a little more about the communities you work in. I know Dorchester is one of them.
This is Leslie. Thank you, Noelle. The question you asked was perfect, I think, because it's really important to consider what our individual communities need or what multiple communities that belong need, as well as individual selves. And in the communities that our program works with, I'm the director of my ombudsman, and we help folks all over Massachusetts, but include Chester, to get their healthcare access needs met through Mass Health. We see that there's a lot of obstacles that get in the way of getting healthcare. Sometimes healthcare is the very last thing that we have on our minds because we're worried about housing, we're worried about our job security, we're worried about how to get to work. I mean, the latest changes in transportation accessibility in the upcoming month, just next week, and it impacts so many communities, including folks with disabilities, people of color, folks who rely primarily on public transportation to get to work, to visit their loved ones. It's so impactful, and so I think that from my personal perspective, I mean, there's so many things that COVID has shown me that we need, but one of them is just fair wages for the folks who are essential workers, making sure that they get the pay that they deserve for being essential. We're talking about folks who helped us get our food, folks who helped us get our medications, people who cleaned up after hospital rooms would go, would empty out, and all the turnover with staff. Like there have been some folks who have been consistently on the front lines, and I really hope, and I really want to see that our representatives show more interest and more care for the folks who are at the front lines. And that includes the hotel industry, restaurant workers, everyone, just folks who have been considered essential and yet who have not been shown and compensated for their essential work. That's what I really think we need, but that's just one of many things. So that's my personal thought. And thanks, Noelle, for chiming in.
This is Noelle. Thank you so much, Leslie. It also reminded me why we're calling on Boston hospitals to stock Paxlovid in ERs, because currently, for the most part, you need a prescription to have it, which usually comes from your primary care doctor. It can come from a pharmacist, and Dr. Julia can talk about this more, but we know that this structure of administering this vital treatment for COVID unhoused people and uninsured people, it's much harder to get, especially if you don't have an address to attach it to or a healthcare plan to put it under. And more through this pandemic, we're seeing people who are unhoused, Black and brown communities, and people who don't have insurance. We're impacted more by this than anyone. So that's why it's important, because that's so many Boston residents that our city accommodate that. Does anyone want to, of our panelists, share a little bit more about why we're asking the mayor to declare all healthcare facilities with access to Paxlovid must make it accessible to all patients who need it, regardless of their insurance?
Ed?
Go for it. This is Ed. I will spotlight you.
Okay. Thank you, Leslie, for that discussion. That was great. We need this because there's going to be a lot of struggles coming up. The employers are taking advantage of the pandemic now. People coming back to work with great difficulties, and they are literally lowering wages, lowering insurance. We know that in Local 26, we suspect the hotel workers will be out on strike next year. So we're going to shut down the hotels, and as we did 5 years ago. And the reason is because the employers think that they can take advantage of what's going on. And non-union places, it's terrible what's going on. We need Wu, Marty Walsh. We need everybody to step up and put pressure on the employers and help out the unions. But more so, we actually need people like yourselves to get in when there's a struggle of the workers, to get in and help them. I know I talked to the Starbucks workers today, and he says the reason they've been able to sustain their struggle is because of the community participation. And I know that when we went on strike, it was whatever little participation by the community and leaders, and but people on the street coming to help, that's going to be big. And also organizing your own workplace. That's it. Thank you.
This is Noelle. Thank you so much, Ed. 100%. I'm just scanning to see the other questions. We're getting so many coming in.
And we're going to switch interpreters again, please.
Perfect timing. Give me the go-ahead when you're ready.
We need Katie Eller to be spotlit.
Let me just.
Thank you.
I'm sorry, who was the speaker at the moment?
I'm sifting through our questions to find a question to ask. And this is Noelle speaking. Anyone from our panel will take the question. Awesome. We have a question about COVID vaccination rates. This is Noelle. Someone saw a stat saying that most Massachusetts residents are not fully vaccinated, meaning maybe they got their first shot, but they don't have their second or their booster. And they're asking, what does that mean for the state of COVID in Massachusetts? Any of our panelists, feel free to jump in. And again, anyone who's not a panelist, if you have a question, even that pops up, please totally feel free to ask it.
Okay, this is Julia Koehler. I'm gonna say something about vaccination rates. If you look at especially children's vaccination rates, you again see vast disparities between white upper middle class communities and working class or Latino and Black communities, vast disparities, where some communities like Newton have a children's vaccination rate for 2 doses of children between 5 and 11 of 90%, Arlington over 95%, and New Bedford 26%. That was on the 27th of July. So what does that reflect? It reflects lack of outreach, lack of information, lack of easy decision making. I have the vaccine, there's a van that comes to my childcare place, or there's a van that comes to the park, or there's a van that's in front of the school during vacation offering to vaccinate children. And the same thing, of course, is true for adults. Just as a little aside, we now have a very, very infectious COVID variant called BA.5. And it is the boosters that are going to protect against hospitalization and death, not necessarily against infection. And so if we have lagging rates of boosters, meaning the 3rd and the 4th dose, that means that the communities that have less boosting are really not protected against hospitalization and death. It also speaks to the importance of everything else we're talking about: workplace protection, ventilation in schools, access to masks, ability to wear masks at work, like nobody says, no, you can't, you're going to scare off the customers. Access to testing, access to paid sick leave, rent control. All those things are necessary because now we have this tremendously infectious variant. I'm just going to mention 2 more points. So we need outreach, we need information, and we need vans where people can easily access them after working hours, on weekends, so that these vast disparities get better. So 2 more quick points. Number 1, long COVID is a big problem. And long COVID simply means that we have symptoms beyond 4 weeks after the infection, and those symptoms last an unknown period of time, but they can be a wide range of issues, and they also are different from the organ damage that we can also get after COVID. That's a separate issue. You know, we can get blood clots, kidney damage, brain damage, heart damage, lung damage after COVID that stays with us and that medical testing can find. Long COVID, medical testing cannot prove whether we have it or don't have it. The CDC estimated that 20% of people who've had a COVID infection get long COVID. I don't know if that's, because that is a lot of people. I don't know if that's an overestimate, but regardless, we are basically creating a vast number of either temporarily or indefinitely disabled people by letting the virus run rampant the way it is now running rampant, and the way that lifting protections in schools, the way that the CDC has now said is fine, and neglecting frontline workers, the way Leslie highlighted, the workers who actually literally keep us alive. So there are issues with COVID that are not being addressed, and that those long-term issues are very high on the list of issues that we need to address. One last point I want to make about Paxlovid, because if you don't stop me, I'm going to go on and on because there's so much more to be said. For example, about the epidemic of sadness, depression, and anxiety that is not being addressed except by people in this forum, and Noel, and, you know, good people who join together with others. But I want to make one quick point about Paxlovid, and that is what we really need is a phone line. People need to just be able to call up in their own language, not with, you know, if you speak Creole, push 5, but actually in their language to talk to a clinician who can talk them through whether they can take Paxlovid and who can send in a prescription. Now, just for everyone's awareness, Cambridge Health Alliance has such a phone line. It's not perfect, but it is the only one I know of. Obviously, ERs need to be able to give it out and need to have it and need to be giving it out, but many of them I think are. But we need a phone line for people who took a test at home, who cannot go to the ER, who are scared of getting a bill if they go to the ER, who actually may get a bill if they go to the ER because they don't have health insurance, and who all they need is Paxlovid. So we need that phone line, and the state should make it available. It should be in far more facilities than at Cambridge Health Alliance. And it needs to be in so that somebody just calls the number, picks up the phone, and starts speaking in their language or saying their language, and then they will be connected to the appropriate interpreter with whom they go through the process and connect with a clinician and a prescriber. Thank you.
This is Noelle. Thank you so much. And I know we're calling on you a lot, but just one more question for a lot of people who don't know. Dr. Julia, could you kind of explain some of the symptoms, maybe little known symptoms of part of what people experience with long COVID? Because I know for me, I feel like I'm learning about a new symptom almost every week. I know some of the biggest ones can be memory loss or brain fog, just feeling kind of lost and out of it all the time. I know chronic fatigue, exhaustion is a big one, lingering cough, asthma. But are there any others that you're seeing, especially a lot in Boston right now, that people should look out for?
So long COVID, like I said, it is not diagnosable by any currently known tests. It is a collection, it is a list of symptoms, and you, Noelle, pointed out some very important ones: loss of energy, dizziness, inability to stand up, tiredness, memory loss, body aches, muscle aches, sleepiness or sleeplessness, diarrhea, other problems in our gastrointestinal tract like nausea, failure of COVID symptoms to resolve, like you said, shortness of breath or cough, headache. So it is a very broad spectrum of symptoms. And as you said, Noelle, there is overlap with the so-called chronic fatigue syndrome. And people are trying to research it and trying to figure it out. I am hopeful that it will be figured out over time. In the meantime, a lot of people are suffering from it. They don't know where to go. They don't know where to get care for it. The communities that have been hardest hit have the least access to care for it. And just one thing I will say, in my hospital, Children's Hospital, appointments are booking out months and months and months and months in advance for the long COVID clinic because there are so many children with it now. So since since we're thinking about disability, it is something that affects all age groups, and it is a major reason why we still need protection from infection itself, not just from hospitalization and death.
Thank you so much, Dr. Julia. I know that we're often saying, especially now as school is right around the corner, it's so important to get your kids vaccinated. And I know there are a lot of questions about the safety of the vaccine for kids. So this is a great place to ask them. If anyone has those questions, feel free to.
And we can switch interpreters, please.
Sure, it gives people time to think.
Please spotlight Joe Toledo.
This is Noelle. I'm on it. Should kick in. There we go. Perfect. But yes, it's so important, of course, to get our kids vaccinated. We know the vaccine is safe. Side effects are temporary, but what else can we do to protect our kids in schools? We know masking is important. We've heard that tonight. Thanks for joining us, Felix. Yeah, we'll probably end up maybe even wrapping out a little bit sooner if people don't have questions, but protecting kids in the school year is really important. So I just want to give a little bit more space. Thank you so much, Aviani.
Regarding school, I'm just going to hop in for one moment and say that this is Julia Koehler, that ventilation is critical. Kids are maybe not going to, even if there were a mask mandate, they may not be able to wear the mask at all times. They might forget, they might pull it down a little. And that's when the ventilation kicks in, because you can think of the virus like cigarette smoke coming out of the nose and mouth of somebody who has the virus. And it will spread like cigarette smoke, but with no smell. We can't see it, we can't smell it around us, and build up as a cloud around us. And if that air is being exchanged quickly, or alternatively is being filtered, then that cloud of virus smoke gets diminished and removed, and the people around us who breathe the air that we have breathed out are much less likely to get infected. That's why ventilation in schools is so critical. Why schools in every community need to be retrofitted with good ventilation systems. And I would say that every parent and every community leader should put that at the top of the to-do list that they advocate for.
This is Noelle. I love that example of, I've heard the cigarette smoke example before. And I know that's also a good way to test if you have a good mask, if you can smell someone smoking a cigarette through it. Isn't it true that like the virus particles are about the same size as cigarette smoke particles or molecules? I've heard that from another doctor as well. It excellent just kind of reminder of the importance of having airflow for sure. I remember when I was a kid in school, we'd often put the windows up. I don't know if they do that now, but being in open air, I'm really glad we have all these outdoor events right now, making it much safer to be together. Great, awesome. Well, it looks like opening windows is.
Noel?
Yes, I'm not sure who's speaking. Can you say your name?
Yeah, Ed. This is Ed.
Hi, Ed.
I just wanted to, I have to leave soon. I just want, this is a wonderful thing, and everything everybody is saying is fantastic. I just wanted to remind people that we had 1 million people or more die, and for many reasons. But one of the big reasons I would say is that if you look at the countries that had a lot better support and a lot less people dying, there were countries that had much bigger union participation. We have one of the lowest participations of unions, percentage of workers in a union in the world. Those that had a higher percentage of unions had less deaths and people catching COVID. So I just wanted to leave with that to show that the struggle is a big part of this thing, and it's both community and union struggles are vital to get this stuff done. So this is a participatory struggle. So that's it. Thank you so much. This is fantastic what y'all been doing. Thank you.
Thank you so much, Ed. And Ed, take a look at Julia's comment in the chat. Everyone should. It's a really good comment on what you're saying. I just want to call on Brenda. I see your hand up, Brenda. Go for it.
Okay, this is Brenda. I would like to know if a parent knows that a school or in a kindergarten class that the teachers are not, really helping the children to be as safe as possible. And like 3 or 4 students had gotten COVID within a 2-week period. What can they do about it other than we took my granddaughter out of the school?
This is Noelle. Great question, Brenda. Does anyone want to take that? I'm thinking Julia and Leslie would be perfect to take this.
You want to go, Leslie?
This is Leslie. I'd be happy to go. Brenda, excellent question. And I think it's really, really tough to answer that question because there's so many different factors that play a role. But I will say that with teachers especially, there are so many different stressors going on, and I'm sure they're on top of trying to take care of the kids. They're trying to teach lessons, and they're doing so much. So what I would recommend, coming from the perspective of someone like our program does a lot of mediation with between patients and their healthcare providers. I imagine that it might be something similar to mediation with teachers. It's like really trying to get in touch with that particular teacher and seeing, what are they going through? What are they experiencing? And seeing, and really also relaying and how direct that our teachers, just like our healthcare workers, are under a lot of stress, and really, I hope doing the best they can with the situation they've got. I think directly for our parents and our families that they'll, I hope, have the chance to reflect that and see what's in their power to do. It's for parents, for family, have the time to just like, you know, PTA meetings, things like that. But that's another recommend to make those concerns, especially with other parents. I'm also thinking similar to what Ed has said about unions with your fellow workers. Like even if you don't have a union, you can go together as a group. And I think bringing these points to the teachers or teacher assistants, whoever you really feel can get on your side. I think there's definitely power in numbers, and going to bring that unified message. They understand that you're going, but so are we. And how can we all work together to get to the same purpose? Ultimately, we all want our kids to have the best education possible, to be safe at school. So teachers are there for that. Our families, we're here for that. Let's all get on the same page. How can we do that together? Sometimes it does, sometimes unfortunately it does take a little bit more from our end to do that. But sometimes just that little push can really go a long way in convincing a teacher, convincing someone who has burnt out by that point to try again and try a little harder. So I think that's my perspective on that's why I'm pushing it. Certainly other ways I'm sure would be just helpful, if not more. But that's what I think is really gathering with other parents, and it's really on that human level with teacher in the teacher in question or teachers in question. Thanks.
This is Noelle. Thank you so much, Leslie. I know on my end, the audio broke up a little bit, but it was great to have the captions as well. So I'm so glad we got to hear everything that you said. But yes, I love the idea of it's all of us working together on the same side to find a solution for all of us. It's not us versus them. It's us working together with our neighbors, with our friends to keep ourselves safe. We have about a time for one more comment. So Julia, did you want to jump in there, shed a little extra light?
I'm just gonna mention that there is an organization of parents in the Boston Public Schools called Boston Public School Families for COVID Safety. They have been advocating to keep, you know, their children safe. They have some knowledgeable people. You could connect with them over Facebook. And although, as Leslie said, there's, you know, a wide spectrum of opinions among teachers as well. The teachers' unions have been trying to keep their members safe as well. So I agree that it is always best to clarify and work out things among the people who are sitting in the same room, in the same school, in the same space, really, in a positive and, you know, at least friendly way, if that's at all possible. And the problem is that when there are systemic issues that really need to be addressed at a level of power, then we don't want to, like the ventilation, I think is a perfect example. We just need those investments in the schools. Ventilation is also good for kids to learn better when the air is not so stale. There's less carbon dioxide and more oxygen in the air. There's studies, there's research that shows children learn better. So we need that better ventilation. And, you know, those issues are solved at a level of power. People who have power to make investments in the schools or to withhold them. And it's good when the people who have to cope with whatever is decided at those levels don't start fighting among ourselves, basically. That would be my thought. But again, if you're in Boston, check out FAMCOSA. There's a lot of smart people there.
This is Noelle. All right. Thank you both so much. And thank you all for staying, coming. I think we're going to end the meeting out. We had several people in breakout rooms, about 10 or so. We will reach out to you and follow up. And yeah, feel free to say goodbye. I'm going to end the meeting in about 1 minute. I'll end the breakout room and end the feed. Thank you so much. And stay safe, wear a mask, and keep fighting, keep talking, having those hard conversations with your neighbors, your coworkers, and fighting for the change that we all need. And we'll keep fighting for you on our end as well, working with our legislators, trying to get our voices heard. Thank you so much, everyone. And thank you to our amazing translators as well.
Grab Kleenex. 7 News today in New England, weekdays starting at 4:30 a.m.